Okay, so I've got orders to do trach care on my patient. Before entering the room, I would do 30 seconds of hand hygiene and check my orders. So I would enter the patient's room, introduce myself. Hi, my name's Alex. I'm going to be your student nurse today. Can you tell me your name and date of birth? And I will look at his bracelet and confirm his name and date of birth. He has no known drug allergies. I would educate or let Mr. Smith know that I have in order to do his trach care. And then I would get started. So I would hand hygiene.
My small but mighty group of students here. Tell your classmates they're missing this some good stuff.
I would apply clean
Not what's
gloves.
discussed, but you for the final, possibly, right?
Maybe.
So reasons why the urine may be discolored. 100%. Yay, you guys rock. Can you do that?
Alright.
For 40.
So the first thing I would do is assess the stoma site. Obviously I would replace that glove as it's ripped, but
Heavy in the calf.
we're gonna keep going.
Okay.
So remove the old
What's the
dressing.
giveaway here?
I'm gonna have a trash can right here and I'm just gonna throw it away. I would assess the stoma site,
Dang.
take a look at it. Yep, it needs to be clean, so we're gonna clean it. Dispose of that.
It's very close, man.
So I've just taken off my clean gloves after assessing the site. I'm going to do hand hygiene. He has no oxygen needs right now, so we don't have to worry about taking oxygen mask on and off. So we're good there. So I've got my kit here. I'm gonna get everything set up. I'm gonna pre-loosen that. Because I just touched it. All right. So I'm gonna open this away from me. I'm gonna go in with this, put on my sterile gloves. Okay. I'm gonna come in this way and put on this sterile glove, which is backwards, so I'm going to touch the outside of it. Come in under my cuff and pull it down. So I've got my sterile gloves on. I'm going to take out my drape, and it's going to go shiny side down. I'm going to empty the contents of my kit onto this. Okay, now with my non-dominant hand, I'm going to remove that cap, come around the back, not going over, and pour saline into my 2 smaller bins. And then I'm going to take my hydrogen peroxide and pour that into my big bin. I'm going to move that off to the side because this is a dirty hand. So now I'm going to take out the inner cannula. I'm gonna drop that into my cleaning solution. If there's a bunch of secretions, I'm just gonna let it sit, but there's not, so I'm gonna take it out. I'm gonna pass my wire brush through. Make sure it's clean. And then I'm gonna clean the outside of it. Throw that in the trash. That would be a trash can, not my sterile drape. And then I'm going to rinse it off in the saline and take one of my pipe cleaners here and use it to dry it out. So that's all dry, trash. This is gonna go back into the patient's trach and lock on. So now that I've got that, I'm going to take my Q-tips, put them in the saline solution. I'm going to clean underneath the trach site, trash that. Same thing on top of the trach site. Trash that. Now with the gauze pads, I'm going to take one, dampen it, and clean underneath. Trash. Take another, clean on top. also clean off any kind of gunk that's on this white plate here. So I clean that off, trash that, and then I would take my dry one and just dry the area real well. Trash that. So now if the trach collar was soiled or needed to be replaced, I would do that by taking the new collar and putting it on first before taking off the old one to make sure it stays secure. But his trach collar looks fine, doesn't need to be replaced, so what we're gonna do last is replace our dressing. So this is just gonna come in here. That's all neat and tidy. Mr. Smith feels good. He tells me, thank you so much for the care. And during the procedure, I'd make sure he's doing okay, oxygen saturation's okay with his pulse ox, respiratory status. If he had secretions, I would have suctioned those before I started the trach care, but he didn't, so we're all good. So Mr. Smith, you did great. I would clean up my area, gather up all my stuff, which I'm not gonna do because I have to put it back in the kit. Perform hand hygiene, exit the room, and document the procedure that it went well with no complications, and he tolerated it well.